Yeah.
Well, and you make them, it's almost like you're making them dependent on coming to you rather than being able to do things on their own. Why does one yogic breath work really well for grounding and others work really well for the heart? And if those areas are diminished and they would like to expand them, what are some of the simple things they can do? So it's included in the treatment, so they go home with a bit of knowledge and hopefully a lot of relaxation and alignment.
Because that is a memory in the body that they can recall, right? Yeah, beautiful. I love that idea of empowering the client, and I that's where I've been coming from as well, because I remember when I first started my practice, I was always seeing the same clients coming in week after week after week, and like 5 years go by, and I'd be like, they're still in the same place in some cases. And what am I doing wrong? Because I would take it on myself personally. Because I'm, there to help them, and I'm obviously not helping them because they're always in the same place. So I changed my, I really started talking to them and asking them, like you said, to feel and what's going on. And what you're saying is absolutely right. It's, they need to not be dependent on us as the therapist, but to be able to recall that experience and do it for themselves.
I like the way you're explaining it very much. And I first got that kind of responsibility and empowerment when I worked in the CLSC in Chicoutimi. And that was the whole philosophy of the institution at that period of time in the late 70s, was how can you empower each client each time you go.
What was this place called?
The CLSC.
The CLSC in Chicoutimi. Wow.
Yeah. So you were going to small villages along the Saguenay River and doing a lot of different nursing techniques. But also,
who were the patients? The patients. What were they? French Canadian?
Yes.
Okay. So neat. Yeah. So it was learning to help these people to help themselves.
That's right.
Oh,
and they were very, very open. It was a different clientele than you perhaps see in the city.
Sure. And
also we had, like many things, we had a lot more time than we do now.
Yeah. That's the problem today. And the clock is ticking, and the budget is running out, and it's not fun. Please let me tell our listeners once again, we're listening to 99.1 CIDI, 99.1 FM CIDI, Radio Communautaire de Canton l'Est. And our guest is Elizabeth Wallace, and I'm your host, Ilya Kavoukas. We're talking about massage therapy, but really going in depth and pain management and how people can empower themselves, 1 or 2 visits and, getting a feeling of relaxation and releasing stuff. Aligning their bodies and the energy in the body. If it's a little too much on the right or the left, or too up high in the upper body, or bring it lower, and vice versa. So, what else would you like to tell us, Elizabeth?
Well, another technique that I really enjoy and I've discovered over the years is working with sound. And it's been an exciting trip. I've done studies with musical therapists that I did when I worked on the palliative care unit, but also now in different areas like Santa Fe, and how music and sound affects the body, but also how vibration affects the energy field. So I suddenly, at one point, found some Tibetan bowls, and I thought, well, they're really kind of nice, and learned how to be able to play them,
Yeah, nice.
and read a lot of how they're used in the temples. And then one day, it just said, my intuition said, why don't you just put them on the spinal cord and see what happens on the outside of the body? And where before it might have taken me 10-15 minutes to do the alignment of the energy field that was a little bit displaced, with the Tibetan bowl, it took about a minute.
No kidding.
And so it was like a great experience.
Wow.
And another type of a useful object is a tuning fork that has the universal sound of the Om. And I started using that on the different vertebrae of the spinal column. And what it seemed to do from when clients would report is that the little muscles between each vertebrae started to relax. And they could feel the vibration sometimes just locally, and quite often it would go right through their body.
Wow.
And they just felt this deep sense of relaxation. So some of it is experimental, some of it's with research of music therapists, but it's always interesting to me to see how does the client respond, and is it beneficial for them?
Yes.
So that's really bottom line.
Oh, wonderful. And I know I just love listening to bowls. I had no idea that was going on as well. So you're saying that it's better when they're touching the body?
Well, what I mean by the spinal cord, I mean they're not. They're not inside the body. They're on the surface.
So the person's lying on their belly, and you hit the bowl or you start playing the bowl, and you lay it on their body after, or once, or on their body you start to play it.
Do it different ways.
Okay.
Sometimes it could even be above the head.
Okay.
Down by the feet. Then I work much more intuitively. I can't say.
Okay. Sure. Depending
or
on,
if sometimes if the chakra, the energy seems to be flowing outwards rather than inwards, then I would put them on that chakra. But I work with each person differently depending on
What was your best experience working with a bowl, with the sound?
I think for me the best experience is working with a gentleman that had a lot of very great sadness in his life and hadn't been able to express it. And when using the bowls, it was the sound that allowed the brain to stop analyzing. That's my opinion. And suddenly he felt sadness. And he said, I haven't cried for 20 years.
So he started to cry?
Yeah.
Wonderful.
And I got a little embarrassed. I said, no, this is perfect. It's because your analytical mind can't react.
That's it. Yeah.
And you're allowing yourself to feel, which is phenomenal.
Yeah. Which crying, I feel, is a cleansing. The water and the cleansing of all those emotions that you couldn't express.
Or it was dangerous to express.
Beautiful.
Wasn't safe.
Wasn't safe. Yeah, men don't cry.
But also small children often
are not encouraged to cry.
It's a scary place in some homes. And anger and sadness, no, we don't do it.
Yeah, we don't do it. Yeah, we're discouraged as children to show any kind of vulnerability or expressing any kind of anger or pain, and which is normal. We need to express that sometimes. And it's like, I'm not happy. This is not a happy place. I'm not happy. I'm going to let you know about it. Oh, no, you're not. No crying, no yelling, no screaming. Yeah. So becoming an adult and then, having an opportunity to cry is such a healing experience. Wonderful. And just to let you know, you've been listening to an example of the Gregorian chants in the background. These are another way of helping the body to align, just listening to recorded bowls, as you've heard. So thank you so much, Elizabeth, for joining us today.
It's been a great pleasure.
Wonderful. Thank you. And if you want some more information on Elizabeth Wallace, please go to elizabeth-wallace.com and or sunshinecenter.ca. Thank you so much. Have a great day. Bye-bye.